we discuss the Ammonium Muriaticum in 28th episodes of Live Materia Medica series of Dr. Phatak's Materia Medica. So, let us start. A very important remedy in day-to-day practice is Ammonium Muriaticum. So, let us understand the core what Dr. Phatak states. Phatak says that it is a mucous membrane remedy. It is a mucous membrane remedy. Dr. Phatak says that it affects the mucous membrane by increasing secretion and retaining them. Mucus is produced excessively, mucus is thick, white, sticky, mucus is not easily expelled. Common sites of these mucus are chest, bronchi, gallbladder duct, throat and nose. So, patient may say that doctor, my cough comes but mucus doesn't come out. Profuse, thick, white, retain the mucus. Profuse, thick, white, retain the mucus. Another key is irregular circulation, blood in turmoil. Phatak says that blood seems to be in the constant turmoil. It clearly means that burning sensation, throbbing pain, sudden rashes. So, the main core of action is liver, mucus and cough is the classic triad of ammonium muriaticum. Many symptoms are accompanied by cough or profuse milky mucus secretion with liver problem. In day-to-day OPD, we may see that fatty liver, indigestion, abdominal obesity, chronic cough. When cough and liver complaints coexist, we must think of ammonium muriaticum. Muscle feels too short and tight and tense. This is another keynote. Dr. Phatak says that tension and tightness as if muscles or tendons are too short. The sites of these muscles are groin, hamstring, lumbar region. So, these patients have aggravation from walking erect, bending relief, walking bent relieves. This posture is self-diagnostic clue. So, when patient walks and bends, it relieves his complaints. Think of ammonium muriaticum. Constitution, we must see the constitution when patient comes in entering the OPD. Fatty, puffy, sluggish but thin limb, always tired and sore. There is a central obesity, big abdomen, heavy buttock but thin arms and legs. This is not calcareous fatness, this is a ammonium murs fatness. So, key is big abdomen, heavy buttock but thin arms and limbs. Another key is effects of grip, silent background. Ammonium mur is a gift affected remedy, but gift it internal, silent, suppressed. It is not loud crying or no drama. This brings us into the mind of ammonium muriaticum. So, mental picture of ammonium muriaticum is desires to cry but cannot, involuntary aversion to certain person, melancholy and apprehensiveness as if from internal grief, brain paralysis, no weeping, no consolation seeking, just emotional heaviness. In head symptoms, in head pain, heaviness in the head, pressive pain at the root of the nose, often associated with sinus issues, coryza, sluggish liver, hair problem, hair falls, itching scalp and dandruff. In eye complaints, mist before eyes in the bright light, flying spot, yellow spot, incipient cataract. Meaning that circulatory sluggishness, metabolic background, early degenerative tendencies. Ammonium muriaticum has much action on the nose. So, acrid, hot, watery coryza, one nostril block, one open, loss of smell, stuffy feeling in the nose, desire to blow but nothing comes out. Sensation of rough body in the upper nares. In children, coryza with bluish discharges. So, in no symptom, obstruction, irritation and retained secretion. In face symptom, Dr. Phatak gives us a very simple telling picture is face is pale. This pale is not due to the acute circulatory paleness is not acute illness, it is circulatory sluggishness, liver background, chronic state. Patient look tired, drained, puffy and pale. Lips is the strong keynote. Lip burns like a fire. Lips are dry, shriveled, cracked. Must moisten them repeatedly with the tongue. So, burning lips, pale face, thick mucus is the key to the ammonium muriaticum. In mouth symptoms, slimy and burning combination is there. Mouth symptoms, slimy mouth, burning blisters on the tip of the tongue. This tells that excessive mucus secretion, retained secretion, digestive tract involvement from mouth itself. Tongue strip is burning, acidic, irritation, sluggish digestion. In throat, swelling and sticky mucus. So, throat symptoms are smelly throat, throbbing in the tonsils, swelling of the tonsils, internal and external swelling, sticky mucus, stricture of the esophagus. So, clinical part may see in the chronic throat cleaning, sticky mucus, liver issues. So, don't jump on Calibachromicum only, think of ammonium muriaticum in sticky mucus. In stomach symptoms, feeling of emptiness is the key. Desire for lemons tells us that acidic craving, liver and indigestion involvement. In nausea, nausea with bitter water brush, aggravation after eating with shuddering. In stomach, stomach pains, Dr. Phatak described it as a gnawing, burning, stitching pain radiating to the axilla, right axilla and upper arm. So, this right sided radiation gives us the clue about the liver. Pain does not stay in the local level, it spreads, indicating the organ relationship. Appetite is very important, empty sensation in the stomach but no desire to eat. Dr. Phatak mentions that in cancer of stomach, long standing irritation, chronic mucous membrane pathology and degenerative tendencies. In menstrual disorder, diarrhea and vomiting during menses. This indicates that hormonal issue with liver, gut and uterine axis disorder. So, in some cases the ammonium mur is very close to the natrum mur. Natrum mur has dry mouth, thirstlessness and reserve. Ammonium mur has slimy mouth, sticky mucus, liver involvement. Also, lycopodium is nearer to this remedy. Lycopodium has hunger, bloating, 4 to 8 pm aggravation, desire for sweet. Ammonium mur has emptiness without hunger, night aggravation. Ammonium mur has central action on the abdomen, strong abdominal and hepatic remedy. So, in Dr. Phatak repeatedly links that abdomen, liver, cough and mucus. So, its abdomen is chest and circulation. Excessive fat deposit around the abdomen. This is the key. Big belly, puffy abdomen but thin arms and heavy buttock. Spleen and liver pains, eating aggravates. When there is spleen and liver pains, eating aggravates. Stitches in the spleen while eating, difficulty breathing along with the pain. Stool dry, scanty, irregular. Rectal burning in the rectum during stool and after hours of the stool. Burning is present there. Hemorrhoids, with Dr. Phatak says that hemorrhoids after suppressed leukorrhea, blood from the anus during menses. In groin, sprained feeling, tense, sprained feeling in the groin, walking erects aggravation. So, periodicity and time modalities are the importance to the ammonium muriaticum. Morning, head and chest aggravation, afternoon, abdominal worse, and evening, limbs, skin and fever aggravate. In night 2 to 4 am aggravation. This time is very useful in OPD. So, in urinary system, irritation with incomplete relief. Dr. Phatak gives a keynote symptom of profuse and frequent urination, urging but only few drops passes. Urine flows freely only after stool. Profuse urine with ammoniacal smell. Urine improves after stool, not independently. Urinary complaints improves only after bowel movements. Always think of pelvic congestion remedies, and ammonium ore is high in them. In female complaints, as discussed, menses too early, pain in abdomen, in small of the back, flow more at the night. Prolapse of the uterus, weak pelvic floor, sluggish circulation, fat on the abdomen. Leukorrhea like white of the eggs, pain around the navel, aggravation after urination. History of suppression, hemorrhoids after suppressed leukorrhea. In respiratory system, Ammonium Muriaticum has deep mucous membrane remedy, cough, profuse mucus, liver symptoms. Never sees Ammonium Muriaticum cough as a isolated chest problem. In larynx, hoarseness, burning in the larynx, irritation of the mucous membrane and circulatory unrest. Cough is the characteristic with cough with profuse salivation. Cough with liver symptoms. Cannot breathe from coughing. Cough is exhausting, rattling, mucus loaded. Expectoration, noisy, rattling, tenacious, sticky, difficult to expellate. Not easy, not loose and easy expectoration, not dry and hawking. This is characteristic of ammonium muriaticum. Chest symptoms, pulsation in the chest, burning spots in the chest. This indicates circulatory disturbance, congestion and irregular blood flow. Aggravation from lying on the back, aggravation on the right side. Better in the open air and motion. Profuse posture aggravates plays the important role. In liver and chest connection, one of the most important remedy, Dr. Phatak gives cough with liver congestion, fatty liver with chronic cough, indigestion with bronchitis, right-sided abdominal issues with chest mucus, as it is in the chelidonium. Neck, cervical, swollen cervical glands, fatty swelling on the nape extending to the ear. So, puffy neck, thick neck, rounded shoulder. This is not acute lymphadenitis, this is a chronic sluggish circulation. In upper back, coldness in and sprained feeling. Sore, sprained feeling, icy coldness in between scapulae, not relieved by warmth. The most remedies are coldness better by warmth. But ammonium more has coldness persists, indicates that circulatory disturbs. Lower backache is the key area of ammonium muriaticum. Lumbago, pain increases on walking erect, bruised pain in the coccyx, aggravation while sitting. Groin and hamstring is the clue for prescribing ammonium muriaticum. So Dr. Phatak says again tense and sprained feeling in the groins. That is also in the hamstrings, feel too short, pain on the walking, must walk bent. Sciatica, very important remedy in the sciatica. Sciatica, side is left-sided sciatica, aggravation sitting and better by lying down. This is the key to remember in 3 words: left-sided sciatica, aggravation while sitting, amelioration while lying. So, in sciatica patient, we must ask the side and sitting or walking better and relief from lying or motion. Extremities, ulcerative and neuralgic, fingers and heels, ulcerative pain in the fingertips, pain in the heels, ulcers on the heels. Buttock and body shape, buttocks are large, fat on abdomen and thin limbs. In sleep, erotic dreams, anxious, fearful dreams starts out in the sleep. In skin symptom, bleeding, eruption, peeling of the skin in between finger and wrist, itching of the various parts, aggravation in the evening. In fever, characteristic fever pattern, chill as often he wakes, sensation of heat, better in the open air, chill in the evening, after lying, profuse night sweat, sweat with every motion. So, in the remedy relationship, it is closely related to the calcarea carp, constitutional similarity, but Ammonium Muriaticum has thin limbs, causticum has grip background, Seneca has chest mucous connection, and Natrum mur has grip theme. So, as we discussed earlier, Natrum mur has silent grip with dryness. Ammonium mur has silent grip with mucus, liver, and obesity. As related to the calcarea carp is fappy, cold, and anxious. Ammonium mur has tight muscle, bent posture, sluggishness, and fat on the abdomen, but limbs are thin. In sepia, indifference, bearing down. Ammonium mur has sadness, sticky discharges. In Calibichromicum, ropey, stringy mucus discharges. Ammonium mur has thick, white retained mucus. In rust ox has stiffness better by motion. Ammonium mur has tightness better by bent posture. In causticum has paralysis weakness. Ammonium mur has tension and pulling sensation, pulling pains. So, the totality that we must remember while prescribing the ammonium mur has fat abdomen and thin limbs. Fat abdomen and thin limbs. Silent grief, desire to cry but cannot. Silent grief but desire to cry but can't cry. Thick white sticky mucus. Thick white sticky mucus. Liver complaints with cough. Liver complaints with cough. Tight hamstrings, groin like pulling sensation. Bent posture while walking. Aggravation 2 to 4 am. Better in the open air, walking crooked. So, in the clinic, watch how patient walks into the OPD. Ask, do you feel like crying? Observe the abdomen and limbs. Check the stool and urine relation that confirms you the ammonium muriaticum. So, in 3 words, grip, mucus, and tightness. So, if the patient bends while walking, holds the grip inside, and carries the mucus everywhere, it's a clear-cut indication of ammonium muriaticum. So, this is all about our today's live series about ammonium muriaticum, a very useful remedy in day-to-day practice. The potencies that I use is 30 and 6 potencies, 200. Mostly 30 potency is useful in the many cases of sciatica, mucus in the chest. Sciatica, remembering keynotes are left-sided sciatica is when we see the left-sided sciatica with the pains which are peculiar modalities of that sciatica that we must have to be remember is aggravation while sitting and better by lying. These modalities we must remember in the ammonium muriaticum sciatica. Left-sided sciatica, aggravation sitting, and amelioration by lying down. So, how to summarize the ammonium muriaticum? So, silent grief inside and wants to cry but cannot. Profuse, thick, white, sticky mucus, difficult to expel. Liver involvement with cough, digestion, and piles. Fatty abdomen, thin limbs, puffy, sluggish constitution, tight muscles, hamstring, and groin, feels too short. Walks bent, aggravation, walking erect, better by crooked. Burning sensation, lip, rectum, and chest in the patches. Tools unsatisfactory, burning after stool and urine, better by stools. Left-sided sciatica, aggravation sitting, better by lying. Aggravation in the 2 to 4 am, better in the open air, mucus plus grip. So, grip held inside, mucus held inside, body bent forward. This is the ammonium muriaticum. So, thank you for patiently listening. Thank you very much. See you in the next episode. Thank you very much.